Hey, my name is Courtney Millington. This is my head to toe assessment for peds. It is May 31st, 2022. I'm first going to just start by this is my patient Heather. Here's a scan of the room. Here is my table with all of my tools, and Margaret is going to be videoing for us. So I'm first going to start by just assessing her skin. I'm looking at her head, her face, her neck. I'm looking at her anterior and posterior chest, as well as her abdomen, assessing for color, which is consistent with ethnicity. I am assessing for warmth. It is warm and dry to touch. It is smooth, her texture. I'm testing for turgor and skin elasticity. I see no edema, no bruising, no lesions, no nevi, no abnormal masses or deformities. Her head is normocephalic, midline position, and symmetric. I'm going to palpate and inspect the scalp. Her hair is evenly distributed. It's blonde and coarse. I see no masses, no tenderness here. Looking for any infestations or indentations. I'm going to palpate your temporal arteries for tenderness there. I'm then going to palpate your lymph nodes. So preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. I'm then going to assess for TMJ, so just clench your jaw, feeling for any subluxation, tenderness, or crepitus. I will then assess cranial nerve number 5, trigeminal, by just again having you clench your jaw, and then close your eyes and tell me where you touch, where I touch.
Forehead, nose, left cheek, right cheek, chin.
Perfect. And then if you could open your eyes, I'm going to do cranial nerve number 7 for facial symmetry. So smile with your teeth, and then frown, raise your eyebrows, puff out your cheeks, and pucker your lips. Perfect. I'm then going to move to her ears, and I'm looking for shape and position. They're symmetric on her head. I'm palpating the pinna and tragus for any tenderness there. Felt no masses. I see no discharge. I'm going to then assess in the auditory canal and the tympanic membrane bilaterally, which the auditory canal is without redness. The tympanic membrane is visible, pearly gray, and the cone of light is visible. I'm also going to assess cranial nerve number 8 with the Whisper, Weber, and Rhine test. So if you could close this ear and tell me what I whisper.
Cat.
And then close this ear and tell me what I whisper.
Dog.
Perfect. And then for the Weber, I'm going to strike this and place it on your head and just tell me if you hear it equal bilaterally or on one side greater than the other.
Bilaterally.
Perfect. And then for the Rhine, I'm going to place it back here and then to the side, and you just let me know when it stops each time.
Now. 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 Now.
Perfect. So air conduction is greater than bone conduction. I'm then moving to her eyes. I am looking at her lashes, her brows, the palpebral fissures. I'm inspecting the conjunctiva and the sclera, which the conjunctiva is moist and pink. The sclera is white. Her eyes are brown. I see no lesions or discharge, no abnormal colors or hemorrhage. I'm going to assess cranial nerve number 2 for gross visual acuity and peripheral and central vision. So I'm just going to stand 6 feet back. If you could read the smallest line with both your eyes.
LTFPH.
Close one eye.
LTFPH.
And then the other.
LTFPH.
Perfect. She has 20/20 vision in both eyes. And then peripheral and central vision. So just let me know when you see my fingers.
Now.
And again.
Now.
Perfect. Cranial nerve number 3, which is ocular motor for direct and consensual pupillary response to light. So just looking straight ahead for me. And both eyes constrict bilaterally when the light is shined into them. And then I'm going to assess accommodation and convergence. So just keep your head straight and follow my finger into your nose and away from your nose. And then cranial nerves 3, 4, and 6, ocular, motor, trochlear, and abducens. Again, just keeping your head straight and following my finger. Perfect. And then lastly, I'm going to assess both eyes and inspect for the red reflex as well as all other internal eye structures. Perfect. I'm then going to move on to the nose that is midline and it is straight and symmetric. If you could just close each nostril and breathe. And then the other and sniff. Nares are patent. I'm going to palpate the frontal and maxillary sinuses. Do you have any tenderness? And then cranial nerve number 1, which is olfactory. If you could just tell me what you smell.
Excuse me, coffee.
Perfect. I'm then going to her mouth, and I'm looking at her lips first. I'm then looking at her teeth, up and up, and her gums, the buccal mucosa, her hard palate, soft palate, under the tongue. I'm looking at the salivary ducts, posterior pharynx, and grading the tonsils if present. Cranial nerve 9 and 10, vagus and glossopharyngeal, just sticking out your tongue and saying ah. As the uvula and soft palate rises symmetrically with phonation. And cranial nerve number 12, hypoglossal, sticking out your tongue again. And tongue is midline without fasciculations. I'm then going to her neck. The trachea is midline. And then I'm going to palpate her thyroid glands, swallow, and I feel no nodules there. I'm going to assess the carotid arteries one at a time bilaterally that are 2+. And I'm going to also auscultate for any bruits which are not present. I'm then going to move to the posterior chest, looking for any deformities, looking for symmetry, looking for any signs of respiratory distress, such as use of accessory muscles, tripod positioning, nasal flaring, no cyanosis, tachypnea, or to retractions. I'm first going to start by assessing for symmetric chest expansion, just breathe in and out. Perfect. As well as symmetric tactile firmatitis, if you could say 99.
99.
And again,
99.
perfect. I'm going to percuss in the intercostal spaces. And then auscultate as well, making sure to get the lateral lung fields. Just getting your sides. Perfect. I'm then going to test for agophony by just having you say E.
E. E. E. E. E. E.
And then bronchophony, just say 99 when you feel it.
99. 99. 99. 99. 99. 99.
And whisper rectally, just whisper in 1, 2, 3 when you feel it.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Perfect. I'm then going to move to your anterior chest. Again, just assessing for symmetry and any deformities. I'm going to test for symmetric chest expansion, just breathe in and out. And tactile firmatitis, say 99.
99.
And then I'm going to auscultate for any adventitious breath sounds. Just take a breath. Perfect. I'm then going to let you lay down with your head at a 30 to 45 degree angle. And I'm first just going to assess, let's turn your head each way, assessing for any JVD, which I do not see present. Assessing for jugular pulsation, inspecting for any heaves or lifts. I'm going to, sorry, I forgot. I'm gonna let you sit up. Sorry. And I'm going to assess, auscultate your heart sounds with both the bell and the diaphragm. So I'm listening to the aortic, pulmonic, Erb's point, tricuspid, and mitral. and with the bell, aortic, pulmonic, Erb's point, tricuspid, and mitral, and also finding and palpating the PMI, and then listening in that area for 1 full minute to get the rate and the rhythm, which is regular, and a heart rate of 70. Now I'm going to have you lay down again. And I've already assessed for the jugular pulsation and the JVD, any heaves or lifts. I'm then going to palpate in all the fields for any thrills and the aortic, pulmonic, Erb's point, tricuspid, and mitral. And again, listening with both the bell and the diaphragm, aortic, pulmonic, Erb's point, tricuspid, and mitral, aortic, pulmonic, Erb's point, tricuspid, and mitral. I will then move on to the abdomen, first assessing for the contours and the symmetry. And it is symmetric, it is flat. I'm going to first listen for bruits in the aortic, renal, and iliac arteries, as well as the femoral, which I do not hear any present. And then I'm going to percuss for any Tiffany, flatness, or dullness in all 4 quadrants, as well as auscultate in all 4 quadrants, which are vowel sounds are normoactive. And I'm going to palpate for any masses or tenderness, any tenderness anywhere, and then palpating the spleen, and then the liver. Just take a deep breath in. Perfect. I'm then going to have you sit up and assess for CVA tenderness. If you feel anything back there, yeah. Perfect. Let's turn this way. And I'm going to start by looking at the joints of your hands and your wrist, your elbows, and your shoulders for any swelling, tenderness, nodules, crepitus, symmetry. I see no redness, no swelling. I'm going to let you squeeze my fingers. Hand grip is 5 out of 5 strength. And the radial pulses are a +2 and equal bilaterally. Testing the capillary refill in your fingers, which is less than 3 seconds. And then I'm going to assess for vibratory sensation. Okay. And then I'm going to do range of motion. So we're going to start with your fingers, which is going to be flexion, extension, and then we're going to do hyperextension and abduction and adduction in and thumb opposition, and then your wrist. So again, we're going to do flexion, extension, hyperextension, radial and ulnar deviation, as well as rotation. Your elbows, which are going to be flexion and extension, and then we're also going to do your shoulders. So it's going to be flexion, extension, hyperextension, external rotation, internal rotation, and then circumduction, and then adduction towards your body and abduction away from your body. And then I'm going to test the strength through your biceps and triceps. So just push out towards me and then pull in towards me. And then cranial nerve number 11 for shoulder girdle and accessory muscles. So shrug up against me, and then adduct out, or adduct in and abduct out, and your shoulder strength is a 5 out of 5 as well. I'm assessing the skin overall, warmth, texture, any deformities. I'm then going to move to her lower extremities, assessing again the toes and the wrist, the knees and the hips and the joints for any crepitus, tenderness, symmetry, nodules, masses, redness, and swelling. I'm going to assess the capillary refill in your toes, which is less than 3 seconds. Their dorsalis pedis pulses, which are +2 and equal bilaterally, as well as the tibial pulses, which are +2 and equal bilaterally. I'm then going to have you push down on my hands and then up, and ankle strength is a 5 out of 5, and then with your knees pull back and then push forward, and that strength is a 5 out of 5. And with your hips, I'm going to have you abduct away and then adduct in, and that strength is a 5 out of 5. I'm going to have you, then I'm going to have you do range of motion of your toes. So they're going to be flexion, extension, flexion, and then abduction out, adduction in, and hyperextension. And then in your ankles, we're going to again do rotation, and then dorsiflexion, plantar flexion, and then with your, and then I'm going to do light touch sensation. So just let me know where I touch you and that you can feel it. Perfect. And I'm going to assess your deep tendon reflexes. So your brachioradialis, and then your biceps, and then I'm going to do triceps, and then I'm going to do your Achilles, and the Bensky, and your patellar. Perfect. And then I'm going to have you stand up. We're going to do range of motion of your knees. So bilaterally, so we're going to do flexion, and then extension, and then hyperextension, and then range of motion of your hips. So we're going to do flexion, and then extension, and hyperextension back. And then we're gonna do external rotation, internal rotation, circumduction, just the little circles bilaterally. And then we're also gonna do adduction and abduction. Perfect. And then I'm going to look at your spine, just having you bend over. I'm assessing for any deformities, curvature, scoliosis, tenderness. I don't see any of that present. Let you stand up. We're gonna do turn this way. We're gonna do range of motion of your cervical. So we're gonna do flexion, and then extension, and hyperextension, lateral flexion, and rotation. And then of the lumbar with flexion, extension, hyperextension, lateral rotation, and rotation. Perfect. And then I'm gonna have you turn this way, and I'm gonna get you to stand with your eyes closed and your hands for, I see no swaying, and then I'm gonna let you just walk towards the mirror and back. And when you walk back, tandem with toes to heel. See no issues with their gait. I'm then gonna have you hop on one leg and then the other. And I'm also gonna have you sit down one more time and assess sterogenesis and graft. So if you could close your eyes and just tell me if your hand's over, and let me know what you feel in this hand.
Coin.
Perfect. And in this hand?
Pen.
Awesome. And then tell me what I write in this hand.
A.
And then in this hand?
O.
Perfect. And then I'm also going to test your cerebral coordination. So just hand flip-flop quickly, and then do your fingers together, and then I'm going to have you touch your nose and then my finger. Perfect. All right, that's the end of our head to toe. Thank you.